Hello everyone. In this first aid series, we are here again with this topic of CPR, that is cardiopulmonary resuscitation. Let me tell you that this lecture is only for the basic knowledge about CPR. This lecture does not give you CPR training at all. The CPR training is a separate training. One has to take partly online and partly offline with hands-on demonstration, and you have to get it certified from a government institution or a reliable organization who are expert in giving CPR training. So, as we said, in any emergency situation, there are first aid. There are three things you have to learn. First of all, first aid, which we talked about. Now we are going to talk about CPR, and this is AED training. This is automated electric defibrillation training, which is a very advanced training, and we will see how much we can discuss about on this subject. In this presentation, you are going to learn about what is CPR, types of CPR, what is the aim of CPR, who needs CPR, how to give CPR, CPR in children, which is little bit different from the adults, and what precautions to be taken during giving CPR, and what outcome will you expect when you are giving CPR, and what is next after CPR, training in CPR. So, what is CPR? It is a restoration of vital function of the body, that is namely ventilation and circulation. A person can remain alive only if he is breathing and only if his heart is pumping blood to the other parts of the body. So, that is ventilation and circulation. So, CPR means cardiopulmonary resuscitation. C means you are establishing circulation, pulmonary means you are establishing ventilation, and resuscitation means you are restoring circulation and ventilation. So, CPR is cardiopulmonary resuscitation. In this picture, you can see the two volunteers are doing CPR. One of them is providing compression to the chest, to the heart, that is to establish circulation, and another one is providing breathing, mouth to mouth breathing to the victim, that is giving ventilation, and that is pulmonary or ventilation, giving breathing and ventilation to the patient to establish his breathing capacity. What is the aim of CPR? CPR is started by American Heart Association, or by giving CPR you can increase the chances of survival after the cardiac arrest, and this could be twice or thrice these chances are increased of any victim to get survived after cardiac arrest. So, primary goal of the CPR is to keep the blood flow active until the medical professionals arrive. So, that is what the aim of the CPR. So, till the medical profession arrives, you have to give them breathing and you have to keep the heart pumping. These are the goal of the CPR. Why it is so important? So, it is said that CPR performed within first few minutes of heart stopping can keep someone alive until medical helps arrive. So, if you keep the heart pumping for 4 to 7 minutes till the medical help arrives, the chances of better outcome, there are chances of better outcome. Rescue breathing technique were used to revive drowning victim as early as in 18th century. But it was not until 1960 that external cardiac massage was proven to be an effective revival technique. So, rescue breathing were used in 18th century, but the cardiac compression cardiac massage was established in 1960 when American Heart Association developed a formal CPR program. The AHA recently recommended that people who have not received CPR training initiate hands only. Even if a volunteer or a person has not received CPR training, he can still give cardiac compression or pumping of the heart can be established, and it is called hands only CPR. With hands only, you press the chest. So, press the heart of the victim and release, press the heart, release, and this will establish a circulation throughout the victim's body, and it can be helpful and it can save life. So, hands only CPR. So, here we will discuss about two types of CPR, hands only CPR and traditional CPR with breath. Other CPRs are like standard CPR, hands only CPR, pediatric and infant CPR and advanced CPR technique we are not going to much discuss about. But these two things, hands only CPR where we are giving only cardiac compression, chest wall compression. In traditional CPR, you are giving cardiac compression as well as rescue breath, 2 breath per every 30 compression. How? We will see later on. So, hands only CPR, what are the difference between these two CPR? Hands only CPR, people with no CPR training can also do it, or people who had got training in CPR many years ago had never practiced, is now almost forgotten, then they can start doing only hands on CPR. But people who are formally trained and has got a experience should do traditional CPR, that is a cardiac compression with rescue breath. People who are uncomfortable and not experienced can do hands on training, or people who are experienced should do traditional. It is hands only CPR is only for adult and teens in the breath stage, by otherwise traditional CPR can be given for the children and infants also. Hands only CPR should be given when you are alone, and here there are usually ideally 2 partners are good enough to perform a proper CPR. So, one person will give rescue breath and one person can do compression, but even single trained CPR volunteer can do traditional CPR by giving chest compression, 30 chest compression, then go on the head end and give 2 rescue breath, again come down and give 30 compression. In hands only CPR, when patient has vomited, his mouth is full of some foreign body or secretions and infection, then you can start giving only hands on CPR by giving cardiac compression. If you want to give rescue breath, clean airway is prerequisite. So, always clean the mouth of the patient, get out the vomiters, and with the help of gauze or sponge you can clear the mouth, and then start giving rescue breath. Who needs CPR? These are the causes of victims on victim side which needs CPR. Suppose it is heart related problem, like patient has a massive cardiac heart attack, electric shock or cardiac arrhythmia. Then neurologically patient had spinal injury, spinal cord injury, acute trauma, and patient has become, because of shock and everything, become unconscious, head and neck injury, unconscious patient. Because of some respiratory problem, patient has become stop breathing, like asphyxia. This usually happens in gas leaking, on mountaineering during going to the high altitude, sudden lung complex or drowning. And patient is in shock, patient because of massive hemorrhage or too much of bleeding, or because of anaphylaxis, that is allergic reaction, is in shock, then they will need CPR. So, these are the situation where you have to give CPR. How to give CPR? In previous slides we saw DRABC, but here the ABC is reversed to CAB. So, how you will start? First, be quick, smooth and not rough. Your all movements should be gentle, precise and focused. Resuscitate within 4 to 6 minutes, that is very much important. Separate two C's, that is cause of the suppose patient is asphyxiated because of gas leak, at least remove him from that situation. So, remove the cause and casualty, the victim from the dangerous situation, and then start basic life support or CPR by CAB, CAB, first compression, then clear airway, then give breathing. So, CAB is your dictum for starting CPR. Always first compression, then airway and then breathing. That is the way you have to start. So, what is a C in CAB? It is a compression. The picture shows hands position on chest compression. So, you have to make use of your two hands, put one on another. So, feel lower part of the sternum, here is the sternum. So, in chest feel the lower part of the sternum and two finger above the sternum, place heel of your right hand and keep left hand on the right hand and lock your fingers, and then start pushing hard and fast on the center of the victim's chest without bending a elbow. See, without bending a elbow, you have to give compression by both the hands up and down. This is the position, right? And how much compression you will give? In adult, the chest should go down by 2 inches and in children it should go down by 1.5 inch. So, this is how the chest compression should be given. You understand the position where the hands are put, understand how to lock the hands and understand how deep you have to go by giving pressure. That is C of the CAB. So, chest compression first. Mouth to mouth resuscitation or CPR with breaths is appropriate to be given to the adult, teen, children or infant. The chest compression technique is different for each age group, that we will see later. Here I have described so far is the one for the adult. In American Heart Association, previously it used to be airway, breathing and circulation, but American Heart Association revised their guideline in 2010 and it announced that chest compression is very important. It should be done first before opening the patient's airway. Before opening the airway and giving breathing, you have to give chest compression first. So, the old model was ABC, has now replaced by CAB, compression, airway and breathing. And since then the 2020 guidelines have been released and the new guidelines say that a person near someone who may be experiencing cardiac arrest should initiate CPR immediately without waiting. Even if the volunteer is not trained, not CPR trained, then also cardiac compression, at least compression, hands only CPR should be started immediately. How and how many compression? You have to give 100 to 120 compression per minute. So, you can imagine how fast you have to work. If you are giving breath also, then you have to give 2 breath and 30 compression. So, after every 30 compression give 2 rescue breath. So, compression and breath ratio is 30:2 or you can say 15:1, but it is usually we call it 30:2 because you have to give 30 compression then 2 breaths. Never interrupt, at least for first 5-7 minutes you do not have to interrupt, not more than 5 seconds. Every time somebody will watch pulse, respiration and pupils, but this should not stop your CPR. It is better to continue than stop. You can tell some other one to check the pulse and pupils and all. Push chest down 2 inches down for adult and 1.5 inches down for the children. So, here 30 compression then 2 rescue breath. This is beautiful picture which can show the 30:2 ratio. Second is in cab A, that is airway. How to maintain airway? First of all, open mouth to clear forehead material. Place in recovery, if patient is unconscious, place in recovery position. Tilt the victim's head back like this. You have to push the head back. With one hand you push the forehead of the patient, this will tilt the head back. Lift the chin, this is the second one, lift the chin to open the airway. So, this is the way you have to open the airway. This is again shown, lift the chin slightly to open the airway. This will prevent, in patient's mouth there is a tongue which is falling back and obstructing the breathing pipe airway, we call it airway, and by lifting it you are lifting the chin, you are lifting the tongue and airway will be clear. Third is B, in cab third letter is B, that is breathing. Here you have to give mouth to mouth rescue breath for 1 second. So, just 2 breath, the CPR volunteer takes deep breath and exhales into the mouth of the victim. While taking deep breath, we are taking 21% oxygen from the air, but by exhaling in the mouth of the victim, you are giving away 14% of oxygen to the victim. So, at least some oxygen is going to the victim. You inhale deeply and exhale in victim's mouth, and during exhale you see the rise of the chest. As if victim is breathing, there will be rise of the chest, and so give 2 breaths at a time. You may use barrier device. Which are the barrier device we see later on, or you can put a small very thin layer of gauze piece or a thin handkerchief like that as a barrier. Another barrier you can see is this mask. This is called breathing mask. If you are a CPR trained volunteer, you can keep such mask in your bag, and this mask acts as a barrier. So, after clearing the airway, lifting the chin, you can put this mask and you can breathe out, exhale through this mask, and you will watch the chest rising. In this case, you cover the nose and mouth with the mask. Watch the chest rising. If you do not have such barrier, while giving breath you pinch the nostril and shut the nostril. So, whatever air you are breathing out, it will from mouth, it will enter into the lung and you can see the chest rising. So, 2 breaths each time, and that should be 1 second apart. So, each breath is only for 1 second. So, you have to act quickly. Performing mouth to mouth resuscitation, this is because in the first few minutes of cardiac arrest there is still oxygen in person's lung and bloodstream. So, by giving compression that oxygen from the heart goes to the other parts of the body, and by giving airway and breathing, whatever oxygen is there in patient's lung, it goes into the circulation. Starting chest compression first on someone who is unresponsive or not breathing normally can help send this critical and this oxygen is very important. That much oxygen can make a victim survive for 2 to 3 minutes. So, that oxygen can go to the brain and heart without delay. For infants under the age of 1 and for children, ventilation rescue breath are in children and infants, you have to do both compression as well as rescue breath. Only hands only CPR will not help. The newest guidelines recommend using higher ventilation rate of at least 30 per minute in the infants younger than 1 year and at least 25 per minute in older children. In these children and infant, you have to give more breaths. If you are trained in CPR and see someone who is unresponsive or having difficulty breathing, follow the steps for hands only CPR for 30 chest compression followed by CPR with breathing. So, suppose you see somebody lying on the roadside and you want to help them. First and foremost, you go and shout, shake and shout the victim whether he is responsive, whether he is conscious. Then call helpline 112. Then check for breathing, whether patient is breathing or not. Then start compression, chest compression by 2 hands. Push hard and fast about twice per second. And if you had training in CPR cycle, then followed by after 30 chest compression 2 rescue breath and follow the cycle till the medical help arrives. So, this picture shows in summation about the step to be taken while performing CPR. This shows the hands only CPR, chest compression, see the position of the hands, it should be straight at the elbow, should not be bent at the elbow, and position of the hands on the chest, on lower chest. So, CPR with brace steps for adults and teens, perform chest compression, open airway, give rescue breath. With the open air, airway open, pinch the nostril before giving rescue breath or cover the nose and mouth both with the mask and then give rescue breath. Give 2 rescue breath each lasting for only 1 second and watch the chest rise on each breath. If it does not, reposition the mask and try again. This we saw how the rescue breath is given and how you will see the chest rising. In adults and teens, continue alternate 30 compression and 2 rescue breath, and if patient begins to breathe, have him or her lie on their side. Suppose with your CPR patient starts breathing, then give recovery position and be with the victim till the medical assistants arrive. This is again showing various pictures about CPR compression in children. Sometimes you have to press only with 2 fingers. The small child, less than 1 year or so, the chest is not pressed with the 2 hands, it is only with the 2 fingers sometimes, and the how much chest should be pressed? Only 1.5 inches below. In children, depending on the age of the child, use 2-handed or 1-handed compression technique. So, first of all, check the scene for safety. If the scene is safe, get consent from the parent or guardian to start CPR. Yeah, this is very important in children at least. So, you inform the parents and start giving CPR, take their consent. Shout the child's name if you know it and tap their shoulder, shout and shake whether child is responding or not. Also check whether there is a bleeding, there is a injury, and this whole thing checking on all should take less than 10 seconds, not much time should be wasted. So, place the child on firm flat surface, kneel beside the child when they are safely on flat surface and give 30 compression. In smaller children, the whole chest of the child can be taken up in 2 hands and with 2 thumb you can give compression of the chest, or with 2 fingers you can give compression of the chest. For an older child, use both hands interlocked. For a small child, use one-handed technique with the heel of hand in the middle of the chest. In children again 100 to 120 compression per minute, and chest should go down 2 inches in older children and 1.5 inches in smaller children. Then open airway and open the airway just past and neutral position by tilting the head and lifting the chin as we saw in the adult, and then give 2 breaths. Blow into the child's mouth for 1 second and confirm that the chest is rising. If chest does not rise, try to retilt the head and ensure that airway is open. Same as other things like alternative compression and breath, 30 compression and 2 breaths. These are the again pictures how to give compression. Many NGOs and humanitarian organizations provide CPR and AED training. That is, Indian Red Cross Society offers courses in CPR and combined CPR and AED techniques, as does the other institute. What is AED? It is a automated electric defibrillator. This is a electric device which gives shock to the heart and the heart starts pumping again. You might have seen AED box at the airport, or maybe in certain institution also you might have seen such AED available. It can detect the abnormality in person's heart rhythm and if needed deliver an electric shock to the chest to restore the normal rhythm. That will bring the heart into the normal rhythm, and which is called defibrillation. So, heart is fibrillating, compressing irregularly. If you give AED shock, it will defibrillate and bring it to the normal rhythm. So, sudden cardiac arrests are often caused by a fast and irregular heart rhythm that begins in the heart's lower chamber or ventricle, and this is ventricular fibrillation, and AED helps to restore the heart normal rhythm. With training in AED and AED, with training only you can use this device or equipment. When used properly in conjunction with CPR, this increases the person chance of survival. This is usually we find in all hospitals should have a AED in the ICU. This is a training how to give compression. This is the AED machine and how it is given. There are 2 pads, electric pads which are put on the chest wall and shock is given. This is the machine. It is portable and one can carry in the bag. This lecture is taken from these references, and again I will say you that this is the basic knowledge in CPR and AED. AED requires definitely very elaborate training and very few people can learn this, and a proper certification is required for its use. So, next time you see anybody lying on the roadside, at least you can start hands only CPR. For that you do not need training or you do not need any certification, but rest of the thing definitely you need a training and certification. Thank you very much.